Botox is a neurotoxin, and we use it to stop muscle function or prevent muscle function for about 3 to 6 months. So most people use Botox primarily for the wrinkles above their nose and between their eyebrows, or the wrinkles along the outer portion of the eye, what we call the crow's feet. At UC Irvine Health, the plastic surgeons here that are performing Botox injections are either in the process of being certified by the American Board of Plastic Surgery or certified by the American Board of Plastic Surgery. You don't know who's injecting you in a medi-spa. You don't know what their training has been. You don't know how many patients they have actually injected. And you don't want to go to somebody who won't be able to help treat any problems if they do arise. So a patient would come in, fill out what we call an encounter form or a history and physical examination form, and then be taken back to a procedure room in order to meet the physician. The physician would come in, sit down with the patient, go over the history physical form, make sure that the appropriate medications are listed, make sure there's no allergies, and then explain a little bit about the procedure, and more importantly, sit down and find out what the patient wants. What areas is the patient concerned about? Is it the frown lines? Is it the crow's feet area? Is it around the mouth? All of those, we would sit down and determine what is the most appropriate option for the patient. We would apply some numbing medicine. Let's say if the patient wants the injections on the forehead, to the forehead area, and perhaps also around the corner of the eye. The needle is a small needle that we utilized, and the injections would usually start in the middle of the forehead in between the eyebrows, and then move usually out towards the corners of the face or the lateral aspects of the face, injecting periodically as we do that. And we would then create a second layer of injections up towards the hairline to help block some of the upper portions of the two big frontalis muscles on your forehead. Botox can cause the eyelid to droop for a period of time. So in order to avoid that, we would stay on the side of where the bone is and not towards the side of where the eyelid is. Once this is done, we tend to put ice back on those areas and let the patient relax for a few minutes. Then the patient is free to leave the office and go back to work or what other functions they like to do.